Hello, and welcome back to another episode on the Unfiltered Healing Podcast. On today's episode, we're going to talk about a topic that not many people think about in relationship to their body, to their health, to the function of their system, and that is their eyes. Now, granted, most people will get their eyes examined and do wear glasses or something of that sort, but we're going to be talking about a very deep layer to the vision and brain system today, which a lot of people miss and which can be a huge component to someone's health, healing, and vitality in their body. And my guest today, Dr. Justin Matsuura, he is a provider that I work with locally here in San Diego. Him and his mentor, Dr. Carl Hillier, have been huge helps of mine for my patients. We refer patients back and forth. We co-manage cases together. And it's been really impactful over the years to see just the dramatic shift in patients when they have a properly regulated nervous system and their eyes are functioning properly. And so we talk about a lot of different things in today's episode. This was long anticipated. I've wanted to talk about this topic for a long time because I've honestly never heard any podcast talk about this topic. So I'm very excited for it. I'm hoping that it reaches more people and they are more exposed to this type of therapy, especially for children because of ADHD and autism and learning disabilities and behavioral issues and focus issues, hypersympathetic nervous systems. All of these can be tracked actually back to the eyes. And as a cranial provider, my job is to first take stress off the eyes and make sure the nerves are functioning properly. But then the therapy comes in to actually change how the eyes are working and teaming together, which dramatically can change, as we talk about in this episode, so many different things. So we talk about vision therapy, we talk about Prism Glasses, which are a big topic lately. We talk about the myopia epidemic in children and teens that's just getting worse and worse. And we also go into lots of different patient cases, just about how this can be so impactful for your posture, for how you hold your body. The tension in your body can be actually from your eyes. So Dr. Justin, brilliant physician. I'm very excited to have him on the episode today. He is here in San Diego, and in the bio, there will be some links to his office and also to some resources that he gives for people to look. Additionally, if you've had a brain injury, this therapy works really well to help rehabilitate your brain and calm it down and to get your nervous system more regulated. You have to look at the eyes as well with brain injuries. It's not the only component, but it is a huge component. And so he gives some resources, so I'm going to throw those in the link in the bio. Make sure you like, share, comment on this podcast because this is very powerful. And maybe we'll have a part 2 because there's honestly a lot more questions that I could ask about the eyes and their impact on the rest of the body. So hopefully we'll be able to have a part 2 sometime and dig into more questions. Let me know if you guys would like a part 2 or if there's more topics that you would like to know and learn about. I'm always open to suggestions, comments, but please share this to somebody who you think would need it. Their children might need it because it can be really, really impactful as we share about in our patient success stories throughout this episode. So without further ado, let's get into today's episode.
What do you do to take care of yourself?
Welcome to the Unfiltered Healing Podcast with Dr. Rachel Hamill.
I ain't Dr. Phil. I'll truly help you heal your mind.
Connect with alternative medicine innovators that will challenge and empower you.
It has the potential to change your whole life.
Create natural balance for both your body and mind.
Your health is very important.
All while uncovering the truth behind modern medicine.
This is crucial.
It's raw, it's real, and it's unfiltered. Here's your host, Dr. Rachel.
Dr. Justin, welcome to the Unfiltered Healing Podcast.
Thanks, Dr. Hamill, for having me.
Yeah, I've been wanting to do this podcast topic for a while. I've been trying to wrangle your mentor and your colleague, Dr. Hillier, to do it,
Right.
which is how we met. So I'm very thankful for that. But thank you so much for coming on the podcast today, for our guests, for myself, so that we can really share about this unique and powerful method of healing that a lot of people don't know about or not exposed to. And I was thinking about it, and I actually don't think I've ever even heard a podcast on this topic. Not that I have heard all podcasts, but I've never personally heard one on what we're going to be talking about today. So, which is crazy to me, but it's also exciting, as the hope is to spread the word about this for people, to get the help that they need. And you just came back from doing a vision therapy and rehab conference with Dr. Hillier. So there's so much to talk about today. But before we jump right into anything, would you mind, Dr. Justin, just giving like a little intro to the audience who may not know who you are, about yourself, what got you into what you're doing now? And I don't even know if I know specifically like how you would classify yourself, because specifically, yeah, it's just like saying, you don't do like typical regular vision visits. So take it away.
Right. Yeah. So thanks. It's the introduction was really kind of you. Yes, I am an optometrist by training. I spent 4 years in optometry school over in up in Southern California, Orange County, and my specific field or kind of specialty is vision therapy and rehabilitation. And what that kind of stems from is a lot of education in pediatrics. I took an interest in that as well as kind of sports vision, and then from there you kind of learn, oh hey, these principles, these treatments, these this kind of patient population, with a lot of kids with learning disabilities or learning challenges related to vision, or even brain injury, or other neurological diseases, developmental delays, autism, ADHD, but they have vision issues that are contributing to a lot of their symptoms. So from there, my practice started to evolve. I met, like you mentioned, Dr. Carl Hillier, who was a big mentor and continues to be a big mentor. I work with him in my practice at San Diego Center for Vision Care, both in our Lemon Grove and San Diego Sorrento Valley locations. So that's where we've kind of taken things. It's been a really cool journey, and I feel like it's continuing in my career. But I get to meet cool people like yourself who get to share how they treat similar patients that we see, and we can collaborate, and that's one of my more favorite things, because I know my colleagues in primary care or different modalities of practice don't necessarily get to interface with allied professionals from other disciplines.
Yeah, it's true. We get to collaborate, and that's the best part, because we can't do it all. But specifically, what you're doing now and what you've learned, are those things that you would learn in typical school setting? Or are there like, foundational things that you learn and then you were exposed to some of what you are doing now in your clinic and it kind of diverged into that? Or is it stuff that you learned primarily in your training?
That's a great question. It's the backbone. The fundamentals are taught, like vision therapy and pediatrics. It is, if you kind of look at all the disciplines within optometry, it is mentioned. But I think for any academic institution, there's only so much that they can kind of get to a student, and even as you go out and to your various sites where you're still under preceptors and your mentors and professors. But yes, the majority, I would say now, is all learned from colleagues, from other professionals, educational events like the conference that I just came back from, which is formerly known as College of Optometrists and Vision Development. But then they just undergone a name change called Optometric Vision Development and Rehabilitation Association. So big mouthful, but it basically is where, like-minded optometrists and other, people who are just wanting to learn can come, get educated, share best practices, and really network, because we know that our message still needs to be spread to people who are falling through the cracks, unfortunately.
Yeah, we have that similarly in our profession too, because, I don't specifically do general things either, but I'll share like a blip of what got me into learning about this because beforehand, this was back when I lived in the Bay Area. I had never even heard of vision therapy, never even knew it existed, never knew like anything that you guys have trained me thus far since. And I learned about it obviously through my own personal, experience with it, which I think happens to a lot of people. But now I'm hearing it, here and there more and more, but it's still like very lower level as far as the grand scheme of things in the vision world. But I mean, I was first introduced to it because I was in college and I was, staring at books and screens and like boards like 24/7 trying to get through grad school. And, I had some other things going on as well, but I just went to, somebody said, look at your eyes. So I went to like, I don't know what it was, like maybe Lens Crafters or something like that. We don't know what we don't know. And I got a pair of glasses because I think I was just having trouble seeing the board. And I think it kind of helped there, but it didn't really fix any of my other problems going on. And I was referred to a specialist there in the Bay Area who's friends with Dr. Hillier and from a cranial person. And he just like opened my eyes and he said, no, your eyes really aren't teaming together. They're super stressed out. It's not only causing the headaches, but you're also in sympathetic dominance and it's creating gut problems and all of this posture problems. And I was like, what? It's like,
Yeah, you're like, what? This is okay. My eyes can do this? Wow.
yeah. And I mean, we don't think of, I mean, now I know now, digging into the brain and neurology, but before, we never really were exposed that you could, even in school, like you could train the eyes, like, they're controlled by those muscles and you can train them, you can do exercises, you can fix where those vision implications have come from. And, now I mostly just wear glasses for an astigmatism, which I'll ask you some questions about later, but most of it was rehabbed. And so, when I moved here to San Diego, I knew that I had to find professionals like yourself to kind of co-manage with. So what makes, what you do and specifically approaching things in your office so different from some of those other more traditional things, like when I kind of went into that?
Yep. But your story, that's probably 80% of the general, hey, I've never really had vision issues, or I need glasses, but it did solve my problem. Now I'm here sitting in your chair, Dr. Matsuura. And I say this exactly what I said. That's the majority of the story. Maybe it takes, a quick, like a month to kind of find us. Other than it takes years. And there's, can be struggles sometimes, and it's hard. But yes, the vast majority is we're trying to do specialized exams, different than say your 20-minute, 30-minute, health checks, refractions, glasses, contact lenses, making sure the retina and everything structurally is good, right? You need that. That is the same reason why we go get our teeth clean twice a year. Vision should be once a year, right? But for the way I practice is, hey, most of the time they've already had this done, or they've gone to several, primary care, optometry, ophthalmology, and it's still just, I don't feel right. I get headaches. My eyes don't feel like they're working in the way that I need them to, or something's changed. I had an accident, or I got sick, and things are not quite back to normal, even though my eyes were told by my doctor are fine, 20/20 vision, retinal health is good, no problems. Sorry, there's nothing else that looks like we can do. So then where we come in is then we're taking a look more at the function. We're taking a look at, like you said, how the autonomic nervous system can play a large role in this sort of dysfunctions, these almost syndrome-like presentations. And from there, if a single prescription glasses, prisms, things like that, even just modifications that you can just do around your house, or your computer position and taking breaks, if that doesn't work, then we consider vision therapy and rehabilitation.
Yeah, and I think that's so common even when I'm doing like a history with a person, and I ask a lot more questions than typical people like you guys do, but because I'm looking more at their brain function. So I'm asking questions about their eyes and how that relates to their posture and all of those things as well in their body. But they kind of just shrug it off a little bit, like, oh yeah, I wear glasses, or, oh yeah, I got LASIK, or they're fine, like nothing's wrong, like I just can't see, or whatever. It's like, well, do you think these might be related?
Totally.
And it's just
Totally.
like, it's so separated.
I know. It for whatever reason, I think it's just the way that we're primed. That's what when we see, that's our truth. That's what we see. Is that it's hard to put yourself in somebody else's eyes, right? You hear that term, walk in someone else's shoes. It's hard to do that for vision unless you're shown via instrumentation or kind of optical illusions, right? You can go, oh, okay, I didn't know I could see it like that. So changing somebody's perception is one of the most challenging things to do, because it's embedded, it's habit. But a lot of times that's what we end up having to do.
Yeah, and for kids specifically too, I know that's one of your passions and you talk and teach about, is finding some of these things really early, because people aren't thinking that, learning difficulties or behavioral, any of that stuff is related to the vision system. But from your experience and what you know and what you've seen, it really is. And that screening is really, really important for kids. And I guess if they don't know some of those issues, then they are just kind of put in glasses if they are. Um, what are, so you talk about how there's like a myopia epidemic in children and in teenagers. Why do you think that is? I mean, I have my own hypotheses, but why do you think that is such a big epidemic now?
I think you and I are aligned on this in terms of, there's environmental causes that are contributing to the way that we use our eyes, and especially in the younger generations. It's very easy to look at, the rise in digital device usage, not only in kids, but also in adults. Yes, there is a genetic component. We know that that's been studied. There's been research on that for decades, but it's not purely genetic. We know that. That's something even, as recently when I was in school, it's like, hey, there's genetic components, and there's very, very likely an environmental component. And right now, what's changed really in the last 20, 30 years, the amount of time that we are being fixated at near point at a single distance for long periods of time. So that's why, again, we're as we wait for, those definitive, evidence articles to come out saying, yep, there's a correlation here, we should do something. I think myself and many of my colleagues, and I think most optometrists, if you talk to them, say, even though they're like, hey, it's probably screens, but no, big organizations are coming out and saying that, and they probably never will, but we're still going to be at the forefront and barking from the mountaintop, hey, think about your eyes, protect those eyes. You only get one pair your entire life. It's not like you can get, eyeball replacements, like knee replacements, and that doesn't exist. So you really have to think about, okay, be mindful of your screen usage. And then I think what hits home for a lot of parents who are having kids is if they've worn glasses, that's strike one there. And if their kid is being screened and they are showing myopic tendencies, or there is myopia already there at a younger age than when they got their first pair of glasses, strike two right there. Then it's just going to start this cascade of, this progression of myopia. And I think we're trying really hard to utilize the latest and best technology, whether it's specialized contact lenses, heavy modifications to their work environment, school settings, to make sure that myopia, although you can't reverse it, try to stop it, try to halt it, try to slow that progression down as much as you can, because you're trying to make sure that later on in life they're not going to have any issues with big scary stuff, big scary diseases like glaucoma, macular degeneration, all the stuff that you should typically get until you're in your 60s, 70s, 80s, the end of life type of stuff.
Right. And I think it's interesting because it's hard to almost manage now, because even schools are like transferring over to all electronic schooling. And it's like, it's tough because kids are not really exposed in the same way. And when we mention genetics, you also, like you're saying, like the whole world of epigenetics is these genetics are changing over time because of epigenetically what we are like giving that environment to express. And so we're seeing more of it genetically, even because epigenetically we're messing it up. So it's like,
Yeah, and I don't know how often you talk to some of the teachers, but when I am meetings with for on behalf of a student where there is a concern about their myopic progression, the teachers know, like, it's a tough situation for somebody who our screen time is potentially impacting their health. So most are very understanding and are going to and do their best, among with all the other things they have to consider for the rest of the kids in their class, like creating hard copies, or being able to allow that student to take breaks and enlarge the font. There's a lot of cool things that I'm hearing, but yes, to address the overall issue, yeah, we're in a tough spot in terms of where some of our kiddos are trying to learn and trying to thrive in their environment.
there's also the portion of light too, right? Because I mean, naturally, what I've read about with the vision and learned about is our eyes are developing in the presence of different colors and outside an environment. And when we put kids in a room, not only with just technology all the time, but also with artificial light and all of these things, that also plays a huge impact, because, we're made to see different colors. Is that part of it as well, you think, affecting the eyes?
It's we're very much, both myself and my partner, we're it's almost like we're prescribing outdoor play. It's kind of weird to think about it that way. I'm sure you probably say the same thing to your patients, but it's like, hey, you probably think of us as prescribing special glasses with, blue blocking tints and all this kind of stuff. Yeah, like that's great for when you have to be on the computer or when you're studying, but you got to get outside. You have especially when they're young, you got to get them out playing, interacting in three-dimensional space, multisensory processing. I mean, that's how we develop. That's how we learn. That's how we fail. That's how we succeed. But yes, from a vision perspective, nothing beats the chromatic spectrum that you get from outside and the sun.
Yeah, gotta get out in nature. Do you use? I mean, not like, because I know what you mean. You're wanting to get more outside, absolutely. But I remember for a period when I was in vision therapy as well, they did use specific like colored portions to the therapy.
Oh yeah.
Not just tints. Like I was like lying in a room with a light. I don't remember what color it was, but he was just like, your eyes are so stressed. You need to lay in a dark room with this light. And I was like, oh, okay. I mean, it felt great because I use red light a lot now all the time, but are there specific things like that as well?
So I think there's what you're talking about is kind of like a light therapy. It's a component that is a lot of times you'll find with vision therapy doctors like myself, will have their own methods and how they treat. So for how your experience sounds like, it was dark room, you know, that was the only thing you were doing at that time for that session duration or something. Um, for me, we have these almost like the 3D movie glasses that you go to watch a movie. It's like the cardboard with the tint on it. So that's the ones that I utilize a lot of times for my patients who have visual stress or they're dealing with a traumatic brain injury, and I need something to relax their eyes, which is probably what you're doing to some extent too. So that's one way to do it. Laying in a dark room. There's even these devices where it's almost like you look through it like a binocular, and then that you're just letting that color spectrum, relax your eyes. So it's called photolight therapy. Some folks call it syntonics, and there's been some really really cool things in terms of case studies on that.
Are there specific colors that you use more often than others in specific cases, or is it kind of obviously everything's case dependent, but there's a spectrum, but are there in general more colors that people are more deficient in?
I wouldn't say they're necessarily deficient, but yeah, for help for sure. I think there's I've seen with my brain injury patients these kind of lighter pinks, or kind of orangish, that kind of are very very soothing to them. Sometimes a very light yellow, maybe a little lighter than yours, to help with the kind of the blue light, the high frequency wavelength lights. And then every once in a while, I'll get somebody who really really just matches well energy wise to this like darker green blue. Just the other day, I had a young man who's who's struggling with his eyes. His eyes tend to cross a little bit more, and when he's on the screen, he feels it. He feels his eyes just constantly straining. He's in a glasses contacts. He's tried it all, but as soon as we put that tint assessment and incorporate it into his glasses with a little bit of Prism, he just said, "Oh, like my eyes feel like they're working better together. I can finally, I feel like I can live a little bit more and have the energy to do it." And that's a tint and some Prism. It's not rocket science. It's not, you need 25 sessions of vision therapy to get you to that point. It's just those little small changes.
Yeah, I have those little things in my office too, the little cardboard ones, because I test them with people too, because people don't believe me. So you have to test things. It sounds bizarre. I know. It sounds bizarre, but I'll throw them on, and it's cool. I've done this with different cases, and I'll be like, your eyes aren't teaming together, and they constantly have like this one-sided pattern on their body as an example, and I'll throw a color on for them, and it like frees up, and they're like, what? I'm like, well, this is how the brain works. You give it the help that it needs, and it begins to release some of that pattern. So I love color therapy. I think it's very powerful, but again, not negating the fact that we need all of the spectrums outside. So that's the best color therapy that you can get. I agree with you there. For kiddos specifically, going back for a minute, what are like some very common things that you either see with children, or getting into this and being in it a while, like some things that you've seen such dramatically change with children that parents may not know the vision is the big culprit here?
Wonderful question. The most common, I would say, issues that I'm seeing in kids, and again, whether this is something they've been dealing with their whole life, whether there's something that as they've started to progress in school and the material is getting more demanding, they're starting to develop these habits or tendencies that are not, conducive to learning and to keeping up in the classroom. Um, Really three categories, I think, that I'm looking at and seeing in kids, unfortunately, to higher degrees. Ocular motor dysfunctions, which is known as like tracking. The eyes are just not accurate for what they're trying to look at, read, jump between target to target, do it effortlessly, not losing their place. That's number one. Two is kind of their focus, not so much like attention focus, but focusing their eyes from place to place, near to far, far to near, and then sustaining that focus without what they're looking at going blurry, or they're trying to kind of fight their eyes to stay focused, whether it's one eye, both eyes, doesn't matter. And then three is the eye teaming, as you kind of mentioned. For you, it's, you can have 20/20 vision in each eye, but put them together, can you still, accomplish what you want to and focus with good depth perception, right? You want your both eyes to point at the same place in space. When they do, you're able to sense where that object is relative to you and other objects in the room. If that is off, or if your eyes are struggling to match that appropriately, you're either going to develop physical symptoms or patterns that result in inefficiencies when it comes to reading, driving, being active and athletic. You just start to see that there are these things that these patients can't do, or they complain that they don't have the words to describe it. So then they'll just say that I'm not sure. I can't. I'm not sure why, but I just can't do it, or I feel, lost to some degree, if that makes sense. So for those kids, those are the three areas that when you have, unfortunately, the triad of all three, you go, aha. So this is a potential reason why on their report cards or their standardized testing, they're not doing well. But mom and dad are saying, hey, my kid is super smart. They're like emotionally intelligent. They've always worked hard. It's not a behavior thing. Why is my child working so much harder than his peers or her peers? Teachers doesn't get it either. They're saying, hey, he's not doing as well as I would think, but he's okay. I don't see anything in the classroom. That's where vision can be almost this under the surface culprit. And that's where I'm again, when they see me and I kind of relay this to the parents, okay, here's where we should focus our attention in your kid's life, and then tell pediatrician, school, whoever's on their team, to help them figure out how to do better.
Yeah, and I guess symptomatically wise or functional wise, the result of that could be some of the things like you said: focus, attention, reading, writing. Are there any other things that can come about that you've seen over the years?
Oh gosh, a lot. There's been even some cases that catch me by surprise and going, I at the time thinking, okay, trying to think of the case here, but patient was shy, maybe a third grader, didn't say much, and it was kind of tough to get a read on, her experience in school. And, of course I find, hey, convergence issue, insufficiency issues, accommodation, the focusing is kind of off, tracking was slow, and not quite where I would expect for her age, to be kind of on that cusp of reading to learn, not so much learning to read. And I remember saying, hey, we should probably do some sessions because you don't need glasses, all that. And then maybe around like 3 or 4 months in, so not fully finished, but enough to where the fundamentals are good, and it's just doing the endurance part now. you start to see her personality start to come out or change. And the emotions that she shows are so much more expressive, and she's happy, I'm talking to the parents, and they're going, yeah, she's actually responding much better in school, and the teachers notice, like, hey, what are you guys doing? Like, did something, did you take her to Disneyland or something? Like, she got really happy. Like, what what had happened? And they're like, the only thing we've been doing is this thing called vision therapy. So that those little examples kind of just remind me, hey, really, because we are using our eyes for everything, the emotions, any sort of behaviors, inattention, a lot of things can be attributed to the eyes and vision because it's in the brain.
Yeah, the eyes are an extension of the brain. But that's a perfect segue. I was going to ask you if you knew, or maybe it's just case studies, are there like any specific visual issues related to someone's personality? Like, have they done anything specifically like that? Or is it just more like anecdotal, patient case wise, you've seen things shift?
Well, so from personality, I'm not sure if there's, big ones about it, but I know, at least talking within our, our colleague circles, there are people are they're the most common example is like a type A personality, right? Somebody who's they need things in order. They need to know what's predictable, usually want to know what's coming, makes them very anxious if they don't know, or it's kind of vague to them. There's almost this tendency for their eyes to be more crossed, more tight, more rigid, and I mean from a teaming perspective, not because their eyes can't move around and be free and restricted, but just when they're focusing on something, they tend to over focus, and that decreases their peripheral awareness, and then everything from there, if there is, their stress points reach the inflection point, or something drastically changes health-wise for them, that posture visually is not going to be very good at handling that change. So when you say personality, that's the first thing that I think of. I'm looking for those type of tendencies to see if, okay, is that something that we should talk about, or somebody I have to refer you to somebody to work on that in addition to vision, like you, Dr. Rachel. It's kind of these different ways in which behavior, vision, they're all interlinked. I completely agree. There's something to it, but I'm waiting on the day where it's these things kind of come out as more like, hey, this is a true thing. Like, you really should consider vision if your emotions and personality are just not making sense.
Yeah, research is slow, but it makes sense, because even as I was talking about in the beginning, as I was first introduced to this, how the eyes facilitate the nervous system function would then facilitate how you respond to things, how you do things, whether it's in sympathetic, all of these things. And a really cool, I've had like several really amazing case stories with vision therapy as well, but one of them, which is really cool, just talking about personality as well, is he ended up having a brain injury when he was little, but he didn't really remember it, and was just like a very flat, like stoic person, not much expression at all, just was very like, very intelligent, but just like flat. That's all I could say. And, this was just after a few cranial sessions first, just helping the eyes functionally be better, started to see personality start to shift. And then when he got vision therapy, because one of his eyes was like literally, I don't know the exact scientific terms, but
Was it out? Was it misaligned?
it's like way over here or something. And he said, and it wasn't that long, but he did like some really intense work, like trying to bring the eye in. And was like literally a different person, like had so much expression. He told me, I went outside the other day for the first time and I felt like I could actually like see the colors and see the landscape, and I've never been able to see that in my life. And he had so much joy and like so much um all of that integration and just able to like perceptually experience life. It was like, wow, I had no idea that this could be so impactful. But so that's why I'm thinking like there's got to be stuff with the eyes and personality and how this all develops with the brain, because it's so fascinating. And it's limitless.
No, that's a wonderful story, because I think that's why you and I love what we do, because you see that change almost like, in a way, click. It fits. Everything's, for that patient. They're now all of a sudden being able to tell you, hey, I've never felt this before, but everything feels right. And there's a lot of gratitude when things go right, or they finally figure it out. That reminds me of a case where it was also an eye misalignment, kind of strabismus, and this guy, he went to the beach, and they'll take walks on the beach and all the time, and I think after even just a couple sessions, so it's very similar, just a couple, nothing like a full recommended sessions, but then whatever it is, this locked in, and all of a sudden his eyes started to work together. It just felt like this calmness, and he looked out at the clouds over the ocean, and he felt like the clouds were like coming on top of him, like just this 3D effect like he'd never seen before, and he thought that was like the coolest thing ever. And after that, he's like, whatever we're doing, keep doing it, like don't stop, please, like give me more, like I just want to keep going. And I'm like, hey, this is great.
And that happens so commonly with brain injuries, is they, people don't think, because they slough off things as just being a little whiplash, whatever it is. And I mean, we don't want to fear everything, but sometimes it can be really impactful. And that's a very common thing you see with brain injuries, is they don't like have that like passion and drive, and like all of those things begin to shift. And, it is other areas of the brain too, but the eyes are a big portion of that. And I know you guys see a lot of brain injury cases in your office as well, being part of the organization, and how that impacts the healing of the brain and getting them back to their life is also really impactful. You guys still see a lot of brain injury patients in your clinic?
We do. I think, over the last 5 years or so, we've definitely seen more cases. I think we've been fortunate enough to kind of, be in an environment here in San Diego where it's like-minded professionals like you and other folks in other professions. They know that they all bring something unique and a different piece of the puzzle. So with any sort of visual cases, hey, the big bulk of the rehab, the physical therapy, the cranial, like, hey, just get started, right? I don't necessarily need to get started, first stop. If it is, great, but if not, no problem. But then being able to almost address these different pieces so that they all start to integrate together, and even after, so it's like, hey, go back to Kyra, go back to PT, go back to neuro. Just make sure everything is starting to flow, because that's how we treat our brain injury cases, because vision is a big part, but it's not the only part.
Yeah, it can be complex. Um, so we've talked about like several times the importance of the eyes kind of teaming together. How do you feel about, or what's kind of your experience about individuals that get like either LASIK or they use some other types of lenses or whatever, and they have like one eye doing one thing and the other eye doing the other thing, as far as like seeing. Because in my view, neurologically for the brain, that's not great. But I don't know if you also feel the same, or if you agree that that's not really optimal for how you know the eyes work in regards to the brain.
No, it's a fair question, because I think when I first came out of school, I also was just kind of like, oh, that's cool. Like it's a technique from a surgical perspective where you get somebody who is clearly maybe not happy that they're aging, their eyes are getting older, and they need a little help reading vision. So they brilliant idea, one eye for distance, one eye for reading, and the brain will figure it out. My mom even had this. She had this done back 30 some years ago. But I think more later on, I see patients where this maybe at the time was good and perfect, but now not so much. Like, especially when their needs change, or now they're trying to reteam their eyes, and one eye is more set for distance, one eye is set for near. They're back in glasses, they're back in contacts, and obviously they're not happy about that, but they're willing to now do it just to have their eyes work better together, because now that's a bigger issue than seeing clearly to them. So yeah, there's times for, where I will say, hey, this is something that you should consider, because it's not just today that this is going to help you. It's obviously going to be one of the craziest, coolest things ever, but down the road, consider what is going to happen, right? When you turn 50, 60, is this something that you're going to be okay with? As long as they carefully consider their options, my patients at least, then I feel better. At least acknowledging, hey, the binocular vision system is designed to be equal focus at all different distances. As we know, 40, 50, that magical age that we're all going to hit at some point, and you're starting to go, oh, I need glasses, or I need something to help me for this. That's until somebody finds a cure for that. You're going to have to address that. You want to make sure that you approach that with the most healthy vision possible, or else you're going to start to fight yourself, and the frustration grows.
Yeah. And other than frustration, what are some other like implications if someone actually really just needs vision therapy, for instance, and just gets glasses, which is like a majority of people, but do the eyes specifically get worse in that? Because I mean, you hear that, not specifically with my patients, because with cranial, usually their eyes get better, but you hear it a lot where they're like, oh yeah, I had to go back, and it's not just age. Like they're like, oh, my prescription is stronger, I need stronger prescription. Like, do their eyes get worse because the malfunction isn't really achieved, or
It's not the source of it isn't. Yeah. Well, I think if you're talking about, if there is an underlying binocular vision dysfunction, and they're treated with first line just glasses, maybe Prism, maybe not, maybe it's just here, where your distance power, but then for reading, here's some more magnification. The binocular vision dysfunction is still there. It's seen as almost, hey, that's a compensation, that's a crutch. It can start to come out more if the physiology of the eyes changes, or demands certainly will go up, especially in kids as they get older, or even into the workforce, being on office setting a lot more. So yes, it's I think people are starting to go, hey, why my numbers are going up higher? What can I do to prevent this? That was not a conversation that I think the general public was educated about 10, 20 years ago. So now, again, that's where I think the majority of my profession has to start, working with these patients more closely or more individualized. And some do. The majority of optometrists coming out now, they are addressing that. And they are mindful to keep those numbers as low as possible, and not just prescribe, and like some medications and stuff, right? So you have to consider keep them low, and if you do just throw glasses on them, and there might be other stuff going on that is still there, yeah, they're probably not going to be 100% happy. They're just going to feel like only part of their need was met. in my experience.
Yeah, for sure. And from your perspective, um, what would you say would be the importance for you specifically assessing like the way someone walks, they move, they hold their head, their neck, when it comes to looking at their vision? Like what's the importance of assessing that, looking at the vision and the movement?
Yep. So huge. That's I think immediately where the vast majority when I get them up and put on special glasses or Prism, and I say, okay, I want you to walk down the hall for me and walk back. They kind of go, oh, what is this? But it's true. The visual system can influence movement and body patterns. So if I suspect a kind of a shift in what they perceive the center of their body to be, and let's say they haven't gone to, they're not getting treatment from other folks, I want to just see if I can influence that to bring them into better balance or to encourage that healing process to start. Or if I identify it and they're seeing somebody, great. Hey, I'm telling that person, hey, we should really be paying attention to how they're orienting visually, so that it doesn't keep resulting in these movement patterns that are causing tightness or single side of the body, type of issues. So movement, we call it vision. Vision is motor. Motor is vision. Is a very common saying in my field, and for us, it's a huge part of what I look at. Gait, shifting more towards one side of the room. They're favoring one leg. They are, and this is, it's sometimes an absence of a brain injury. It's crazy. It's crazy to me. Or even the way that they're slightly, turned, to the left, and they're looking straight, or they have a slight head tilt, almost like a torticollis. I'm looking at, okay, are the eyes responsible for that posture? Why is it more comfortable for them? And then from there, I can treat or refer, because here it is. There's something here.
Yes, it's so important. And for those listening, how many of you have gotten your eyes checked and they've looked at your posture, your body? I would argue to say probably less than 1% of you.
Less than 1%. Yes.
It's just so important what we're talking about, because it all goes together. And I want to ask, because we don't have all that much time left, but I want to ask specifically about the Prism glasses and what is kind of behind that, or what's the power behind that? Because I've like you've said, for posture related stuff, I've heard it's worked wonders for like children who are toe walkers, and then they come down on their feet once they put the Prism on, or like even in recently I've heard it a lot in these groups of like people that are very sick, like either Lyme disease or like mold toxicity. They've been doing Prism lenses, and it's helped them like surprisingly with their brain function and lots of different ways. So what's the power behind Prisms? Like, what are they? What do they do? How are they used?
Sure.
Why are they used?
Yeah. Prism is one of the most powerful things I think that I do, but then I think is also underestimated by some of my colleagues and relatively to the general public. People are going, well, I've never heard of this. So to your point, yeah, there is some mystical power that I think people see in them. Optically, all it does is it just shifts the way light enters the eyes. It's invisible, at least if they're incorporated into somebody's glasses, unless it's a super high amount, which is pretty rare to see. Traditionally, they were used to help folks with misaligned eyes with double vision see single. But the way in which my field of optometry, developmental approach, behavioral approach, rehabilitation, sometimes a little bit can go a very long way. And especially when you talk about folks with, Lyme, neuro disorders, concussion, brain injury, they can't handle a huge amount anyways. So when you give them these almost micro amounts, like 1 unit to half a unit, and you orient it based on what they need, or if you're trying to influence, their postures, it almost tells the brain, hey, this is aligned. This is synergistic for whatever reason. And sometimes it takes time. Other times it's immediate, and you see it in the chair when they put them on. They trial it, and it goes, oh wow, this feels so much better. Or hey, you see your shoulders relax. You see the tension in it just come down. Everything kind of melts and in a good way. So when you ask what prisms do, it shifts light, but it almost is shifting the way that the eyes communicate to the brain. See this way. That's it.
And is that something that they kind of wear long term, or is it a process where they like adapt to that? How do they specifically incorporate those?
Yeah. So I think that the nice part about these prisms is you have the option to do both. They're not designed in contacts as very often. So when they're incorporating glasses, you can sometimes do it as a temporary treatment until they do not need it, or it's something that the condition. Yes, this is something that I do expect you to wear for the rest of your life, but it should be checked, yearly or however often that their doctor wants them to check on it, because it can change, just like any of our powers in our glasses. But most of the time, I would say temporary, especially if it's a developmental prescribing pattern for kids, because I know parents are kind of reticent, especially if they've never worn glasses. Oh, what is this prism? Are they gonna have to be slaves to the glasses forever? Can they do a surgery to prevent? Trying to navigate that conversation is, hey, this is meant to help your child, someone get their function back, get started, you develop it in a better way. And then as time goes on, once they start to habituate, it's like riding a bike. You don't forget how to see all of a sudden. You're gonna, you don't need the prism.
Yeah, I think that's such a great tool because I mean, if someone's overwhelmed or their nervous system is or their brain's overwhelmed as well, and you're able to facilitate something like that, how much more effective will some of those other therapies be? Because now they're neurologically more sound and all of those things. So, yeah, I didn't know that much about prisms, but I do know that they can be extremely helpful, like you've said. And so people ask me, I'm like, I don't really know.
It's just all you have to say is it changes the way light enters the eyes, and the brain will love it. Or it's therapeutic for the brain.
Yeah, yeah, awesome. Man, well, there's so much more I want to ask you, but I know that we are out of time. And so maybe we'll have to bring you on for a part two. But I'm so thankful for you, thankful for taking the time. Do you want to do a little just shout out of your office and, you know, even where people that don't live here, maybe a resource to find someone that might be reputable who they could look for as well?
Oh yeah. Well, first of all, thank you for allowing me to share kind of a little bit what I do, and I want to commend you. For writing your book too. And finishing that, and I thought it was really, really, really interesting to learn about your journey and how it shaped who you were. Because like we said throughout this podcast, we work best when we share our best practices from our respective professions, for the betterment of our patients. So I appreciate you, and really keep doing what you're doing, because it's people need it. My for good. For my staff, you can, if you want to learn more about what we do, my profession, my office. I'm located here in San Diego Center for Vision Care .com. If you're looking for folks who practice in the way that I do, or some of this resonated with you, Optometric Vision Development and Rehabilitative Association, OVDRA. formerly known as the College of Optometrists and Vision Development. There are doctor locators in a search engine built into there. A lot of good content, journals that are constantly being published with some of the things that we talk about on a more deeper scientific level. And from there, and even for brain injury, there's a bunch of what we call neuro optometrists all throughout the country and the world. So if any of those things can help, feel free. But otherwise, feel free to send me a message at my website if you need some help.
Yeah, we'll throw those in the bio for people that they can click after listening as well, so they'll have some of those resources. And thank you again so much, Dr. Justin. As you listeners can hear, he has such a passion for what he does, and he really loves helping people. And so we want to respect his time and thank him for taking the time to do this. Please like, share, comment this episode and send it to those who may need it so that they can also experience healing and health if they need it in their vision system. So thank you again. And for everyone listening, we will catch you all on the next episode.